can pose many health problems. And although it's mostly known to occur in the interventricular septum and the left ventricular free wall, it's possible for it to occur in any place in the heart. This condition occurs asymmetrically within the heart, particularly the left side. And as you can see in this picture, how much thicker the muscle is compared to the normal size heart.
Alright, how does it affect people? People with HCM, their heart muscle is stiff, so it's really thick, and it stops contractions. The myocardium pushes up against the valves within the heart, particularly the mitral valve, and this causes distortion of the valve.
Where's the mitral valve, you guys, on here?
On the left.
You'll see what chambers.
The left from atrium to left ventricle.
And it causes distortion of the valves, which causes blood to leak back through the valve. Muscle fills the spaces in the heart's chambers, so this means that less blood will fill the chamber to be pumped into the body. All this leads to a lack of blood circulation. So if you can't get that blood circulation, you're going to get less oxygen to the rest of your body, which leads to the symptoms of it. It also, the abnormal size of the heart wall slows down the SA node from giving off its electric currents, which throws off the contraction seen to the heart. So it slows it down basically.
We have a little visual diagram of it. So as you can see, the normal heart has kind of minimum tissue, and this one is a lot thicker. So when the normal heart beats, the blood pumps down there and it goes up to the aorta. But in a heart with hypertrophic cardiomiopathy, the stiff muscle gets in the way of the contractions and acts as an impediment, instead of actually making the muscle pump harder and having more blood flow. And as you can see, it takes up a lot of space in the chamber. So less blood is going to fill into the left ventricle, and less blood is actually going to go into the body.
Alright, how do you get it? HCM is genetic, so it means you get it if your parents have it, grandparents have it, you're most likely to get it. And what it is there's a problem in the DNA that tells the part that builds the muscle wall of the heart to increase production of that muscle, thus making it bigger. Increase the.
Also, HCM can affect any age, any ethnicity. It's not discriminate to any kind of groups. So it's possible for anyone to receive it as long as the gene is in your family. So there are two variations of HCM. There's obstructed and non-obstructed. The obstructed version is called the hypertrophic obstructive cardiomyopathy. Another name for it would be asymmetrical septal hypertrophy. And the regular non-obstructed version is the hypertrophic cardiomyopathy, and another name would be idiopathic hypertrophic subaortic stenosis. And you can see the difference between regular and obstructive. In obstructive HCM, the interventricular septum becomes too enlarged and too thick that it blocks off the